Hello. Hi, this is a case of peri-implantitis. This patient is basically has an infection around this dental implant. He had this implant placed about 6 months ago at a surgeon's office that basically has billboards all around our city that promote about implants for $399. The patient felt something and didn't feel like it was
There was
feeling
something.
right. So he came in and asked me to take a look at it. And as you can see, he has about 12 millimeter pockets and suppuration. The surgeon told him to just basically rinse with oxidine and he'll be fine. The other recommendation was once it became loose, then he could come back and they would reevaluate the situation. So apparently the standard of care is wait till teeth or these implants become loose. We prefer to do treatment prior to the implant failing completely. And we've chosen to do a LAPIP process, which is laser-assisted peri-implantitis. So this is the before, a lot of bleeding, 12 millimeter pockets, suppuration. The patient did feel, this is after, 6 months after, and you can see about a 4 millimeter probing depth here around this, about a 3 millimeters around that. And you can see the tissue blanching. So that's showing us that, yes, I am putting a little pressure around there, making sure I get an accurate reading. We didn't get any suppuration, but there on the distal, there was a slight amount of bleeding. So I'm considering maybe down the road we might want to touch it up or retreat again. This is the actual LAPIP procedure. The LAPIP procedure is a patented protocol developed by Millennium Dental Technologies, utilizing their ND-YAG, the Periolase MVP7. The MVP7 is named that way because it has multivariable pulses. It has 7 pulses. Depending on the situation, you have the ability to change the parameters of the laser energy, being
60,
depending on what you want to accomplish.
75.
Unfortunately, Millennium does do 5 days of training prior for every laser that's given,
I'll let you know when you're going to
or sold actually. And part of the training is also to do this procedure here, laser-assisted peri-implantitis procedure.
45,
The nice thing about this and other
55,
procedures is that no scalpels are used. None of the tissue is cut
75,
open. Other than, if you could see the amount of tissue removed, it's about the thickness of cellophane. Now, one of the things here, I do like to go in and reshape any restorative around these implants, making sure there's no overhangs, making sure we have a smooth surface. Some dentists who are doing peri-implantitis cases will actually reduce and smooth off the threads when they have direct access. Recently on the LAPIP Connect, a periodontist quoted the head of prosthodontics at University of Alabama, Mike McCracken, and he asked Mike about cements and maintaining implants after restoration. His reply, quoted directly from his email, is, I scale the question mark number $, percentage out of them. So I scale the bleep out of them. I think the bigger danger is the residual cement. I agree that scaling with metal is not desirable, but you have to do what you have to do. So yes, we do have to do what we have to do. So this is a scaling procedure. Again, also rotary instruments have been used in this case. We are aggressive with our scaling instrument. Again, this tooth or this implant would have been basically explanted in most dental offices due to the amount of infection, due to the amount of peri-implantitis that is clinically shown. Another thing you might notice is that on the after probing dents, you'll notice that the central next to it is not there.
40.
So in just a moment, you're going to see why it's not there anymore. During the healing phase of this implant, that other central did break. You can listen in the background. You'll hear us talking about numbers, and that's the protocol is very clear that we.
You're at 20.
One of the advantages to having the Periolase is it does have a jewel
40.
counter, and to be able to know how much energy is being
60.
placed around these implants is critical, because the implant does
75,
absorb this laser energy. Sometimes you'll notice that the implant actually sparks up. So that's why that tooth next to it is missing. It fractured at the gum line, and restorably, we just decided that it would be better to explant that or extract that tooth. These are some of our staff. That's Vivian, she's our treatment coordinator. Sandra. These staff members, the average time that they've been at our practice is about 15 years. In just a moment, you'll see a picture of the staff. You can find us in Downey, California. Our number 562-869-0928. If you have an implant that is failing, come on by and we'll evaluate it for you. And there's our staff. And in the back, you can see Amy. She was actually started as a dental assistant and now is a registered dental hygienist. You could visit our website. We have johndds.com.